Alright guys, so let's talk a little bit about this whole coconut oil controversy thing. The American Heart Association recently announced coconut oil is bad for you. I don't know about that. Now keep in mind that this is a statement that has come from the same advisory organization that endorses breakfast cereals loaded with sugars and artificial additives. So take what they say with a grain of salt, or maybe a grain of sugar would be a little bit better. So it's important to look at this coconut oil advisory in context. Saturated fats have been proven repeatedly not to be bad for your health or raise the risk of heart disease when you eat a diet that is low in sugar and carbohydrates and high in omega-3 fatty acids, such as from cold water fish and raw nuts. So the real culprit with heart disease is not just how much fat, cholesterol, whatever lipids we're talking about, but more so how much inflammation do you have in combination with those lipid levels. Sugars and carbohydrates are the biggest disease culprits for heart disease. In fact, studies also show it's sugars and excess carbohydrates that inflame the arteries, leading to arterial plaques, triggering production of the bad types of cholesterol, and promoting obesity. So likewise, polyunsaturated fats, which the American Heart Association, or the AHA, recommends in place of coconut oil, and other saturated fats tend to be high in omega-6. Although we need a healthy ratio of omega-6 to omega-3, the average American eats far too many omega-6s already, thus promoting more chronic disease. Excess omega-6, which is ample in polyunsaturated vegetable oils, is linked with chronic inflammatory disorders such as fatty liver, arthritis, and irritable bowel disorders. Chronic systemic inflammation has also been found to increase the risk of heart disease. So meanwhile, cholesterol has been found not to be a factor in heart disease risk. What matters are levels of inflammation, such as those measured in a CRP or homocysteine test and a blood test. Also the levels of bad or dense LDL cholesterol from eating too many sugars. Here's a great analogy that I often use in my practice to convey how fats and inflammation work in the body. Let's say you have a piece of metal sitting outside, and that piece of metal gets exposed to air and water. The air and water causes the metal to rust. This happens by a process called oxidation. Now let's take that and apply it to the body. If we think of the fats in our body as little pieces of metal and think of inflammation as the air and the water, the inflammation will cause those fats to oxidize or rust. This is when the lipids cause heart disease like plaque atherosclerosis and strokes. There's a big difference between saturated and trans fats. Although it's not clear which saturated fats were investigated in the study criticizing coconut oil, the majority of studies linking saturated fats to heart disease include hydrogenated or trans fats. Trans fats are inflammatory, artery-clogging, brain-damaging fats that should be avoided at all costs. It's incorrect to group them with natural saturated fats. Now let me be a little bit more clear. This is not a green light or all clear or full speed ahead to eat as much coconut oil as you want. In fact, coconut oil can be really bad for your heart health. But this usually happens when you start consuming large amounts of coconut oil combined with a diet and lifestyle that continues to be pro-inflammatory. Remember, inflammation is the big bad wolf in this story. In a nutshell, if you manage your blood sugar levels with moderate to low consumption of complex carbohydrates, you avoid sugars and processed carbohydrates, and you eat plenty of omega-3 fatty acids, and your diet includes 7 to 10 servings per day of vegetables and low glycemic fruits, chances are you can safely eat liberal amounts of coconut oil, and probably even should. In fact, coconut oil has been shown to have healthy heart benefits. The heart prefers the fatty acids found in coconut oil as a source of fuel. Coconut oil is also known to increase your metabolism, curb your appetite, fuel the brain, lower triglycerides, and fight bacteria, viruses, and fungal infections. Pretty handy. American Heart Association diet actually raises the risk of heart disease. Unfortunately, the AHA promotes pro-inflammatory foods that are high in sugars, processed carbs, and omega-6 oils, the very foods most associated with chronic diseases. To their credit, however, they also promote 7 to 10 servings of produce a day and ample omega-3 fatty acids, both of which are excellent anti-inflammatory approaches that support heart health. So if you follow the AHA advice to replace calories with healthy natural fats and American Heart Association approved foods high in industrialized oil and processed carbohydrates, you might find both your blood test results and your symptoms get worse. So don't do it. If you think you need some help with your health, give my office a call. I even do Skype or online appointments. I'm Dr. Craig Mortensen. Be healthy, be happy.